Hello, this is a presentation about stress in the business of medicine. I will cover stress reduction techniques, and my partner is going to cover the business of medicine and the stresses it is creating and some solutions, some things to look out for on the horizon. For this particular recording, this is a practice recording, not the presentation that is actually going to be given. I have a habit of recording my practice sessions where I determine timing and fine-tune what I'm going to say. So this is not a perfect recording. And for this recording, I'm going to page through the slides that my partner, Phil Geisinger, is going to cover at the actual presentation. If you're interested in more information on those slides, contact us, and he's the expert in that area, and we'll be happy to help you and your organization with those issues. These are the slides my partner will be covering at the presentation. Okay, now this is my part, reducing stress. The good news. I'm going to give you a quick overview of the impact of stress in the workplace and in particular on physicians and other medical staff. I'm going to talk about a change that is specific to North Carolina law pertaining to licensed medical practitioners. I'm going to talk about the difference between healthy and unhealthy habits of thought, and I'm going to cover a new validated theory of the purpose and appropriate use of emotions that changes everything. I'm going to provide some techniques that reduce stress, and I'm going to talk about how your brain perceives reality. So this article, this picture is hilarious if it's not you laying on the ground. The article was titled, "A Stiff Upper Lip is Killing British Men." Well, it's killing Americans too, both men and women. What does stress do to us? Well, when stress goes up, our mental health goes down. And that feeds back in and increases our stress because now we're dealing with a mental health issue. And when mental health goes down, our chronic stress, burnout, depression, anxiety, and many other problems increase. When stress goes up, our immune function decreases. When our immune system isn't working well, our physical health declines, which increases our stress. So it's creating a negative spiral. Stress also interferes with our digestive function, which has impacts on our physical health, weight management, obesity, diabetes, all sorts of other digestive system issues are directly tied to stress. And then, of course, having those issues increases stress even more. Our cognitive function, our ability to think, decreases when we're stressed. When we're stressed, we tend to focus on problems. When we're less stressed, we are more able to see solutions. We literally don't have access to the same information in our brain when we're stressed as we do when we're not, which means that we don't make good decisions when we're stressed, at least not as good as we could if we weren't stressed. So our success in every area of life and health decisions about what to eat and whether to exercise and to sleep, all of those things are negatively impacted when stress goes up. Our central nervous system function declines when stress goes up, and it increases our likelihood of having accidents, but it also impacts our physical health. So, and that again creates a negative spiral. The quality of our relationships declines when we're stressed. We all know this. We come home, we've had a rotten day, and we're not as nice as we would like to be to our spouse or our kids. Or maybe they've had a rotten day and they're not as nice to us as we would like them to be. And when the quality of our relationships declines, it has an impact on our physical, mental, and behavioral health, because strong social connections, good relationships are very beneficial to all areas of our health. So when our stress makes us grumpy, our relationship quality goes down, and then those other aspects also decrease. So this is a really strong negative spiral that begins with stress. Those are the impacts of stress on our life in a broad general sense. So the change in the North Carolina law is really good news. Prior to this decision to change, question 4 required people like physicians to say whether or not they were obtaining counseling. And what happened is, if the physician said yes, then the board might investigate. And so there was this stigma associated with getting mental health help, where physicians wouldn't seek help because they'd have to then say yes on the form, which would then subject them to scrutiny. And physician suicides in North Carolina and across the nation are up, and burnout is rampant. I've seen studies with up to 40% in some areas that of physician burnout. So the new law switches it around and says that the board expects its licensees to address their health concerns and ensure patient safety. So if a physician or other healthcare provider that's subject to this license requirement is feeling highly stressed, they're mandated to deal with that. This includes depression, anxiety, anger issues, substance use disorders, anything that could later come back if they don't address it. And so they no longer have to say that they're seeking help unless the physician believes that their issue or issues will interfere with their ability to take care of patients. So a physician can get counseling or do other things to address the stress of being a physician without fearing repercussion. And this is a very positive move on the North Carolina's board's behalf, and I'm hoping that other states adopt a similar policy. So let's talk about positive thinking for a minute. Most of us would think that somebody that has a Harvard education would have a really good life. They'd have a really good chance at being successful, and the money and success would lend itself to more stability in their personal life, fewer problems, and all of that. But the research actually shows that positively focused people with a Harvard education have those outcomes, but pessimistic people, people with a negative outlook, even with a Harvard education, do not have those outcomes. They have more failures, they have more alcoholism, more divorces, more suicides, more business failures. They just don't reap the benefits of that level of education. And they don't live as long either. So there's tremendous benefits to positive thinking and tremendous detriments to negative thinking. Well, what does that have to do with stress? Well, negative thinking increases stress and positive thinking decreases stress. And let's talk about happiness and stress for a minute. There's a direct relationship here. When happiness goes up, stress goes down. When stress goes up, happiness goes down. Your emotional state is an indicator of how much stress you are experiencing. Your habits of thought can trap your brain into unhealthy patterns. We think about 60,000 thoughts a day. And out of those thoughts that we think, very few are thoughtful. Most of our thinking is an automatic process. And we have the ability to stop and think about any thought we're thinking and to manipulate the thought, change the thought, and make our life better by doing so. But we have to recognize which thoughts out of 60,000 thoughts. You can't think thoughtfully about 60,000 thoughts a day. It'll drive you nuts trying to do that. So you have to know which thoughts to think about and then what to do with the ones that aren't serving you well. There's a group of habits of thought that we know lead to unhealthy outcomes. They lead to things we don't want. They lead to mental illness. They lead to poor mental health. They lead to poor relationships. They lead to higher stress. Catastrophizing or awfulizing, which is basically seeing things as permanent and pervasive. So something bad happens and somebody says, that always happens to me. Or somebody doesn't get something good that somebody else got. And they say, I never get picked, or I never get to go, or always and never are indicators that somebody is catastrophizing or awfulizing. Now, it can be done on the positive side too. Somebody could say, things always work out for me, and that would reduce stress. But somebody who thinks things always go wrong for me greatly increases stress. Negative rumination is basically complaining and thinking about something that isn't the way you want. Co-rumination is when you do it with somebody else, and rumination is when you're doing it by yourself. And it's just playing over something that didn't go well in your mind and leaning towards the negative. If you lean towards what did I learn, it'll feel better. But if you lean towards that shouldn't have happened to me, or blame, or guilt, all of those things are heavier and they make you feel worse. Self-criticism, you do not need to beat yourself up in order to decide and act on something you want to change. The first time you recognize that there is something about yourself that you would like to change, make a decision that you're going to change it. Don't just beat yourself up for being as you are. Decide to be how you want to be. And don't should all over yourself. Shoulding is like, I should have done this or I should have done that. If it's a should, it's past tense. And you've just basically, it's another form of self-criticism. Low self-esteem leads to poor outcomes. And I'm going to talk a little bit later about a methodology that helps people who have low self-esteem increase their self-esteem. Suppressing emotions is one of the least healthy things we can do. Many people were taught to suppress their emotions. You have to unlearn that habit if you want to live up to your potential for health and good relationships and everything else that folks want. Pessimism is another unhealthy habit of thought. It is not your personality. Pessimism is learned thinking. It's a habit and it can be changed. And if you're pessimistic, you'll like yourself more if you change that habit of thought. And then surface thinking. Surface thinking is believing the first thought you think. It's not asking yourself, why am I looking at it this way? Why did they do what they did? Or why did they say what they said? It's simply being on the surface, and it doesn't lead to good communication. It doesn't lead to good outcomes. And in some environments, it leads to deadly fights. Thinking about what you're thinking is metacognition, and that's a healthy habit of thought. And it's one anyone can develop, and it will help everybody who does. So that leads right into the healthy habits of thought. This list is not all the healthy habits of thought, but it gives you a good example of healthy habits of thought. So respond proactively to emotions. And if you don't know how to do that, it's kind of hard to do. I'm going to give you some techniques later on that will help you respond proactively to emotions. Optimism is also habit of thought. Because it's a habit, it's something you can develop. Reframing is part of metacognition. It's looking at something in a different way. Let's say somebody gets laid off and they're upset, they're angry, they're bitter, they're upset about all those extra hours they gave to the organization that clearly didn't appreciate it, yada, yada, yada. So reframing it would say, I learned a lot during all that extra time I put in, and I'm actually ready for a bigger job and a bigger challenge. So, and I probably wasn't going to leave because I'm pretty loyal. So maybe this layoff is the kick in the butt I needed to find the better job I'm ready for. And see how just shifting that around lightens it up, and it's a completely different perspective. You're putting a new frame on the same situation. Positive affirmations can be healthy habits of thought. If you try to stretch too far, they can actually be detrimental. And the way you know is if your mind starts arguing with the affirmation, you're reaching too far. Take a smaller step. Reappraisal is a lot like reframing. Uh, she doesn't have her Ph.D. Catherine Pell's research on emotions shows that even one-celled amoebas have an emotional feedback system. The difference between that one-celled amoeba and a human is that the one-celled amoeba always responds to its emotions and in the right way, whereas humans will override our emotions and do things that are detrimental to us. Looking for the silver lining. You can find someone who has found a silver lining in any situation. If you're struggling with something, or find someone who has found a silver lining in similar situations and see if you can't find a silver lining in what you're going through. If you make it a habit to start looking for the silver linings and even going back to things that happened in your past and finding the silver lining in those things, you'll find that you can actually be looking for the silver lining like that, just almost immediately when something happens. And your suffering from whatever it is that happens is shortened sometimes to seconds, and sometimes so quick it doesn't even, there is no suffering because you're quickly focused on the silver lining. Savoring, that's celebrating your wins. It's appreciating things. Yesterday I got an email from a friend, a LinkedIn friend, who is in a similar business to I am in the United Kingdom. And she sent me this note, and it just felt so good when I read it. I sat there and just savored her words for 5 minutes, just let them soak through me and permeate me. How often do we do that? Somebody says something nice and we don't give it any attention. Give nice things attention. Self-love and self-respect, healthy self-esteem, metacognition I've mentioned already, and cognitive restructuring, which is reframing, reappraisal, changing the way our brain looks at the world. Being open to new experience is healthy. A growth mindset, an openness to learning new things. An internal locus of control, which is the belief that your actions and your thoughts and your words have an impact on the outcome you're going to experience. And positive thinking is a healthy habit of thought. Your personality is not you. The newest research is very clear that our personalities change a lot more than they used to think they did throughout the lifespan. And I've worked with quite a few people who have changed their habits of thought. Their personality changed when their habits of thought changed. And in every case, when somebody moves to more positive habits of thought, they like who they become more than they like who they used to be. So a lot of people have a fear that if they change too much, they might lose who they are. When a person becomes positively focused, they literally say things like, I'm being more of what I always thought I could be. This is that thing that was missing. This is who I wanted to be. And it's amazing the things that they will say along those lines. So don't worry that changing habits of thought, that you'll lose who you are. So why do we have an epidemic of mental illness? Why is stress so rampant? Society got off track in their understanding of emotions, and there's a new evidence-based theory of emotions, and there's a growing body of research that supports it. Personally, I've been using the techniques for a decade, and my life got so much better the first year as I understood this and has continued to do so. So let me just give you this. Imagine for a moment that you're an alien. You've come to Earth. You've never even seen a chicken, but you've bought a house and you're trying to make friends with some Earthlings. And you found out that they have friends over for dinner. So you decided you were going to get one of these chickens and you were going to cook it and serve it to your friends. And you bought this cookbook, and unfortunately, it had a typo, but you don't know that because you've never even seen a chicken, much less cooked one or eaten one. And the typo was that you would cook the chicken to 120 degrees. So you had your meat thermometer, you followed the instructions, and then you put this very raw chicken on the table for your guests. Because there was a typo. But there's no stigma involved in a typo. We have been given the wrong instructions for understanding our emotions. Our emotions are a sensory feedback system. Our eyes are a sensory feedback system. Our ears are a sensory feedback system. Our sense of smell is a sensory feedback system. The researchers now believe that emotions are our oldest sensory feedback system. And the purpose of emotions is to guide us towards self-actualization and away from danger. So, talked about that. Now, negative emotions are telling us there's a different perspective you can take about the subject you're thinking about. So stop, think, use metacognition. How else could I look at this? Why would that person say that? Do I think that the way I'm taking it is the way they meant it? Or could they have meant it some other way? Can I get clarification? You could spend hours on that. You generally don't have to. The more you practice it, the faster you get at it. And so you stop, think, and only after you think about how you're receiving the message do you do. Do you speak? Do you respond in writing? And it makes a tremendous difference in the outcome. I have one gentleman that I work with who he will describe himself. He will say, I used to be the drunk guy on the sidewalk that cussed everybody out. And today, he doesn't want to think a negative thought. He attributes this process to a significant change. He said that that stop and think process allows wisdom to come into the interaction. And he's right. It really does. And sometimes we're so interested in responding quickly because we think a quick response makes us look smart, like we think fast. But this process, if your response is coming from a negative emotional state, use the process. If it's coming from a positive, excited state, you're probably good. You're not going to do a lot of damage from a positive emotional state. From a negative emotional state, I think probably everybody has at some time or another said things that they wish they could scoop back into their mouth and wish that they could erase from the memory of the person that they were speaking to. So this process is a really good one to remember and train yourself that when you feel negative emotion, stop, think before you do. Emotional guidance is simple. Positive emotion simply means you're moving, thinking, speaking, or acting in the direction of your self-identified goals. Keep moving. You're on your path. if you keep a long-term perspective, what feels best is best. Now, short-term, that drink or the drugs or the chocolate cake, the shopping expedition, they might feel better. But if you have long-term goals and you keep a long-term perspective about your decision, if it feels good, it's going to be in your best interest. It has the lowest stress, the best health outcomes, the best cognitive abilities because stress is lower, the highest intrinsic motivation, and the highest level of resilience. So this is a very simple way to describe it. It's the children's game where you hide something and you give the child clues. You're getting colder if they're getting further away from what they're trying to find, and you're getting warmer if they're getting closer, and hot when they're right on it, or cold when they're really far away from it. If you think about positive emotions as getting warmer and extreme excitement and eagerness and passion, those are hot. They're right on it. And depression and frustration and anger and rage and irritation, all of those are getting colder and cold. And you see how simple that is to think about it? So the warmer is moving you towards self-actualization, and colder is moving you away from it. When you recognize that when you're angry at someone, you're off your path, it's really easy to let that anger, it takes practice at first, but eventually it gets really easy to just let that anger go because it's not serving you. It's not letting it go for them, it's letting it go for you. And I want to talk about how your brain works, but not which part does what. That doesn't help you in this process. So your emotional guidance, the direction of thought, you have a thought and then your highest level of self-actualization, the highest potential that you've conceived of that you could have, is compared. And if it's moving in the direction of that, it feels lighter, it feels better, it's getting warmer, it's moving you closer to your goals. If it feels worse, it can feel heavier or colder, moving you away from your goals. If there's no movement, it feels the same, you're not moving closer or further, and whether those thoughts are serving you or not depends on how they feel. If they feel good, there's nothing wrong with staying in a good feeling place. If they don't feel good, you want to try to find thoughts that feel better. So our senses bring in about 10 million bits of data every moment. Think of it as big data. But our conscious mind only gets about 50 bits of data every moment, and that data is filtered below the subconscious level because our conscious mind can't manage the big data. So there's about 186 cognitive biases, but there's 4 that if you just work with these 4, they can make a significant difference in the amount of stress you feel every day of your life. You've got all the inputs from your senses, and then the filters that I encourage people to pay attention to are beliefs, expectation, emotional state, and focus. So all that big data goes through this filter, and these aren't the only filters, but these are ones that really matter. And then you have your perception of reality. We experience a perceived reality. We do not experience the same reality as the person sitting next to us, because if their beliefs or expectation, emotional state, or focus is different, they're experiencing something different than what we're experiencing, even though we're sitting side by side. Stories are not lies, because lies are something that you consciously create. If you create lies, a backstory is created at the subconscious level of the brain to make sense of the experiences you're having. So this is an example I use with the employee engagement training I do. So we're told all the time that if somebody is not engaged, we should give them a lot of compliments. But if the person who's not engaged has low self-esteem and doesn't think they do a good job, so they're core self-evaluations are low, and we give them a compliment, it can't get through to them. Their brain will create a backstory that is consistent with their beliefs about their goodness that makes our comment make sense. And unfortunately, that's not going to cast us in an authentic, truthful light. They may think, oh, well, she's trying to butter me up. She's trying to make me feel better. And we're actually giving an honest, authentic compliment, but because they don't believe it's true, their subconscious mind creates this backstory for them. Or they'll create a backstory that's even worse that makes it consistent with their core beliefs. Let's say that you're given a compliment and the person did a project or a speech, something that they really didn't want to do. They think they did a bad job, but they knocked it out of the park. So you're the boss, you come along and you tell them that, and they think, she's just telling me that because she wants me to do it again, and that's the last thing I ever want to do again. She's trying to trick me into doing that again. Well, that's not going to increase engagement. So understanding this impact of core self-evaluations, a manager can't change it because when they try, it just bounces off those core beliefs. It doesn't go through. The only person that can change those core self-evaluations is the individual whose beliefs they are. But you can teach them how their brain works and help them through this back door. So all communication is translation. This can thing is, it's not as bad as that, but it can be, depending on what beliefs somebody has about the situation and the people involved. So what you say isn't what they hear. It goes through the filter and there's a personal perception. And what they say isn't what you hear. Really makes a difference in the communication. If we stop and think, did they really say? Let me ask for clarification if they meant what I heard. So stress can be increased, it could be multiplied, added to, subtracted from, or really diminished. And the way you use those habits of thought is what determines what that does. And this, I've already talked about the different negative or unhealthy habits of thought, but this diagram shows you that you can have a potentially stressful event, and somebody who's catastrophizing the situation multiplies the amount of stress they're feeling. Somebody who's worrying about it is adding to the stress they're feeling. Somebody who thinks more generally about the event and sees it from a larger perspective will actually reduce the amount of stress they're feeling. And somebody who sees that silver lining or an opportunity in the problem, they're actually diminishing that stress so much they may not even be stressed. When a coworker who's catastrophizing about the situation is freaking out with stress. So the way we see the world, our habits of thought, and we developed most of our habits of thought when we were children. We didn't think, oh, will this habit be good for me? Will it lead me to the life that I want to live? Focus is the easiest and fastest to change, but it doesn't generally result in long-term permanent changes on your initial stressful assessment of a situation. What does that mean? That was a long sentence. That means that you can change the amount of stress you're experiencing. If something's going on, you're getting a root canal. Well, you can think about what the dentist is doing, or you can close your eyes and float away to a tropical paradise. That change of focus can reduce your stress level. And almost all the dose-dependent methods, the commonly recommended methods of stress reduction, are dose-dependent, and they're based on changing focus. So exercise, petting your pet, helping others, going outside, meditation, unless you have a very rigorous daily practice. Meditation is dose dependent. comfort food. I've got more slides later on if we have time on dose-dependent stress reduction. Only a small percentage of our thoughts are thoughtful. Surface thinking versus metacognition. Most thoughts automatic. It's not original. I talked about that already. Most thinking is programmed thought. How do we know when thoughts, words, and actions would benefit from original thought? By how they feel. So we think a thought, we feel an emotional response, and we think another thought. By changing our thought, we can change our emotional response. If it's a more empowered thought, our emotional state will improve. If it's a less empowered thought, our emotional state will decline. This is really important when you're thinking about people you may supervise at work. Autonomy feels empowered. Lack of autonomy feels disempowered. So that there's a lot of different factors that go into that you can tie stress to emotional state and to the thoughts. But you can change your thoughts. The researchers until recently were really bugged by how come we can't just change our emotional state? And the reason is the purpose of our emotional state is to guide us. And if we could just change it, it wouldn't be able to serve that purpose. So I've talked about metacognition previously. It doesn't accept the first thought you think about a topic as the truth just because you thought it. Our thoughts reflect our mood. If you walk into a room and you're frustrated, your brain at the subconscious level will filter out everything in that room and put something that's frustrating in your conscious mind. If you walk into that room in a state of appreciation, your subconscious mind will give you something to appreciate. If somebody is angry, their mind will give them something that will maintain their anger. I am convinced that our brain thinks that we have deliberately cultivated our current emotional state and then works hard to help us maintain it. When we deliberately start changing our emotional state, we can change our chronic emotional state, because once we get to the emotional states we want, frequently our brain starts supporting us in maintaining them. I talked about reframing. Okay, appreciation is a process that's very helpful. When you appreciate things that are in your life. So if you have a practice, every morning tell yourself, today I will find 3 things to appreciate. And then at the end of the day, at dinner time, if you share dinner with somebody, make it a practice. Everybody goes around the table and shares 3 things that they appreciated that day. Talk about it for at least 30 seconds. Actually feel the state of appreciation. Don't just say, oh, I appreciated that the sun was out today. Say, oh, the sun felt so good today. It just, oh, I could feel it warming the earth and making the flowers bloom. I could feel it on my, oh, I just loved. Actually feel it. And it will train your brain to look for things that you appreciate. I don't have time to get into the details right now, but the research actually shows that appreciation is a more effective process for 2/3 of the people when compared to gratitude. And so I encourage the use of appreciation over gratitude. If to you appreciation and gratitude are identical, you're the part of the 1/3 where appreciation or gratitude, it won't matter which you call it. I talked about reappraisal. Those are the 2 most powerful tools you have to think more positively and have less stress in your life. There's a lot of techniques that I teach that I haven't had time to cover today that help you see things differently. One is to go general. If you're thinking about something, let's say you're having the worst day of your life, well, that's very specific and very negative. And probably the whole day wasn't bad. Probably it was a small part of that day. So if you go general and say, well, if this is the worst day of my life, all the other days of my life have been better. That feels way better. And tomorrow will probably be better because it's not likely I'm going to have the worst day so far of my life followed by an even worse day. It might happen, but that doesn't happen very often. It's unlikely. So going general, refuting something. Somebody says something to you and it hurts your feelings. Don't accept it as your reality. Number one, whatever they said is a reflection of their current emotional state, far more than it's a reflection of who you are. So refute it. And you can tell when you think about it. Let's say somebody says that you're, I don't know, lousy at something that you think you're good at. If you say, no, I'm good at Parcheesi, that feels good. That's your emotional guidance saying, yes, that thought serves you. So don't accept other people's opinions of you. Looking for the silver lining, that can be really helpful. Some of the hospital systems are bringing in psychologists to work with physicians and other practitioners, and they're booked solid within a week or so of coming on board. The programs that I teach, I prefer a large classroom because I don't need to know everybody's nitty-gritty stuff in order to teach them how to change the way they view the world and how to use their brain more effectively to reduce stress. So it's far faster to serve large populations, and I personally think that it's as effective, if not more effective. I've had clients who have had chronic, significant depression with suicide ideation for decades, who have been completely depression free for going on a decade after learning these techniques. I worked with a Vietnam vet in the early days of my company who had PTSD that was making him basically a recluse, and his PTSD has subsided so much that he went to one of these Get Motivated things in Charlotte, and he was sitting on the floor of the auditorium when they set off fireworks, and he didn't even jump. He's traveling internationally every year now. The difference in his life is he's living. So I'm not opposed to the individual one-on-one counseling, but this is something that I think everybody needs because we all have stress. We all have things that go wrong. And it helps you recover if you've got mental illnesses already, but it can prevent them. And with the epidemic levels that we have going on, that's important. The EAP program, for most employees, they won't call until they're ready for a mental illness diagnosis. They don't call for mild stress. Sometimes they don't think it's confidential. They see it as stigmatized. They think they have to ask permission from the boss or HR. Sometimes they don't know it exists. I don't know how they don't know that when there's so much communication. But the EAP program would be overwhelmed if every person who's stressed started calling the EAP program. It's not set up for that kind of volume. And so it's good to have it, but it is not the solution for stress. Adversity makes us stronger is a myth. The truth is that adversity makes us stronger when we have a positive mental attitude. Adversity tears us apart when we have a negative mental attitude. Over 80% of us will experience at least one traumatic experience during our lifetime. Many of us will experience multiple traumatic incidents during our lifetime. Every time there's a traumatic incident, there is the potential for problems. And Positive thinking protects us from those problems. I don't really have time to talk about human change in depth, but when you change the belief first, the thoughts, the identity, the words, the actions all change easily. When you try to change behavior without changing beliefs, you've got a big wall there, and it's rarely successful and almost never successful long term. Our beliefs are like this big bull elephant. Our willpower and our reasons to change, the reasons it's a good idea, are the men that are pulling it. Now, this is not the circus elephant that was raised to think it's weak and that rope around it is, this is a big bull wild elephant. You can't budget with willpower and reasons. You have to directly change the belief in order to change the behavior. And we can define who we are. We can decide who we want to be and change our belief about who we are. And when we do, that all changes. I don't have time to cover this chart. So, common stress reduction suggestions. A lot of people suggest to think positive. I never really see anybody other than myself tell you how. And if it's not the habit of thought, it's almost impossible to think positively. In fact, it adds stress because the person is thinking, oh, well, I should be thinking positive, and I'm not. So they're beating themselves up for yet one more thing. I said earlier that I would talk about more of the dose-dependent stress reduction techniques that are not permanent, and I'm going to have to go through it really quickly because I'm out of time. So time with friends and family, time outside, time management skills, art, reading, prayer, doing something for others, being creative, deep breathing, gratitude, I already talked about that, petting your pet, 18-second hugs, sleeping, journaling, confiding in a friend, meditation, and yoga. But none of those are permanent changes unless meditation and yoga can be if you have a very rigorous practice. Thank you very much for your time, and we would be happy to answer any questions you may have.